they continue pushing even when it has stopped. Okay, the key is you want to start opening up and just letting go. So foot, can I have someone with a foot? Oh, you want to? Do you want to record? Is that it? Are you going to see? Okay. I need to see your foot.
Or you're supposed to do that. At least when he was in school, they put pins in there. Yeah.
Okay, so, well, for example, now here, if you want to do a tibia on the talus, you can have this, something like this. You will distract with this hand. So now I'm going to have to set it up heavier because I'm going to have my hand and her foot, okay, here. And then I can take a contact on the tibia, distract here, and then I'm going to fake it, okay? And then from here, I don't know if you see, but, and then push, so distract with this hand as I thrust with this hand. Boom. Okay? So if you want to do any kind of APP way at the styloid, you can use this. So this is going to be usually maybe a little too hard. Depends on how inflamed it is. Then you can use a Pinard. Okay. Any of the lateral to medial, can you turn a little bit? Here, that's it. You can use it like this. So again, the same thing is, I will try to take the contact. I will distract here and then use as a drop. Okay. Any of the tarsals, cuboid, if I want to push it this way, if I want to bring it down, the tarsals, the metatarsals, then I may want to go from underneath, the one that I specifically want to work on, bring a soft pisiform and use a distraction, okay, or use a distraction pushing through. So in that case, it will be more here.
What were you contacting?
Here it was a metatarsal head that I would go. So I would go to the metatarsal head here if I want to, okay, and then distract, or it can go distraction and then pushing it through, like, okay. Or as far as the base, I could hold here, distract. It's like while I hold, okay. Or I can go, can you come a little closer? Yeah. Like this, if I need to push it down. So again, distract, push it down. So it's like here I'm showing this way, but I could be holding all the rest and push only on this. Or I can just be doing a direct soft pisiform. If you need to do plantar to volar, if you want to turn around, right, and then you would have it. So can you turn maybe a little bit more? Yeah, like this. Okay, perfect. And then you would have it in this position here. Then you can push from plantar to volar again with distraction. Okay, metatarsal heads, same. So what I would do is I would, with this one, distract, contact, and push through here. Okay, same for the big toe, which sometimes you may have to do that way, and it's a lot softer that way. For the little toes. Okay, and this, the patient is pretty comfortable usually with that. Can you go on this side down? Something I didn't show. But I mean, it's not complicated once you understand what you want to do. Open up, medial to lateral, you know, and you can do all the tarsals from here the same. What else? I mean, it covers pretty much the whole gamut. You know, you just change the position and use, if you want to use a lot of the action here, Or if you want to use less, you do it at mid part. And it's better to do a light thrust first and do it the second time rather than pounding on it. Well, since we're here, you want me to show some of the, yeah, we'll do that for the upper extremity too.
Thank you so
Okay.
much.
Okay? That's really useful. I would say invest in that. So many usage.